It says joining me to talk about tonight's topics. I need an intro. It's not at the top. The prompter isn't at the top.
Well, third time's a charm. Please stand by.
Healthcare reform may be pronounced dead by June after this week's arguments before the U.S. Supreme Court over whether Americans can be required to get insurance. About 600,000 San Diegans are without medical insurance and up to 46 million Americans. We'll talk about what happens to them if the justices strike down the law. And he was a rock star in the California Republican Party, but this week, San Diego mayoral candidate Nathan Fletcher filed for divorce from the GOP. Is it a genuine move or a ploy to get more votes? Joining me to talk about tonight's topics are KPBS health reporter Kenny Goldberg and KPBS Metro reporter Katie Orr. Kenny, let's start with you. There are 600,000 uninsured people in San Diego County. If health care reform goes away, how do they get care when they get sick? And what happens to them? Who pays for it?
Well, we're all paying for it now. If they have Medi-Cal or another publicly subsidized plan, we're all paying for it through our taxes. If health care reform gets thrown out, what happens to them? That's a hell of a question. Medi-Cal won't go away, so they'll still get care through Medi-Cal or through one of the county's other programs. But I think it's what happens to everybody if they throw health care reform out. That's really the crux of the issue.
In terms of costs?
In terms of costs, in terms of benefits. I mean, right now, one of the benefits of health care reform is that you can get free preventive services, a colonoscopy, pap smear, breast exams, so on and so forth. You get free inoculations now if you're a child.
So that's already taken effect, and
yes,
people are accessing that. How many? Do you have a sense of that?
Well, we don't know yet, but I mean, a lot of people have taken advantage of some of the provisions of health care reform already, and the major ones, when we're going to have a healthcare exchange where people can shop and compare plans and try to get some government subsidies for their health care. That's going to kick in 2014. So there's a lot of things ready to go.
Well, Kenny, aren't people really supportive of the idea that insurance companies can't reject people with pre-existing conditions, that everyone has to get some kind of health care?
Right, and that's in place now thanks to health care reform for children. And that will kick in for adults in 2014, that there'll be no more pre-existing conditions.
So are there some benefits that women in particular are really taking advantage of under health care reform?
Well, as I mentioned, they get free mammograms now, they get free pap smears, other preventive services that everybody gets thanks to health care reform. So if you show up to the doctor, you're getting your annual checkup, a lot of those services that you'll get is no cost to you now.
Most political pundits seem to think, by the tone of the questions by the Supreme Court justices this week, that this health care law is going to get struck down. What's the alternative if that happens?
It depends, first of all, if they strike it down, and it depends how they strike it down. They could reject and declare unconstitutional the individual mandate portion of health care reform and leave the rest of the law intact. Or they could reject the whole thing and tell Congress, you guys have to start over. If they do that, then it's anybody's bet as to what happens.
Well, Kenny, I guess I don't understand what is different about this mandate. The government tells us to do a whole bunch of things. You know, we have to wear a seatbelt when we ride in a car. We have to have car insurance. We have to go through screening if we want to get on an airplane. Why is making everyone have health insurance different?
Well, people that argue against the laws say that requiring somebody to buy a product is what makes it different, and they say that's unconstitutional. It's an unconstitutional expansion of congressional powers to force Americans to buy a particular product. Now, supporters of health care reform and some of the liberal judges would say, well, health care is a different kind of commodity. It's a special commodity that needs special treatment because everybody needs health care at some point in their lives. So why not have everybody have skin in the game and purchase health insurance so we could try to bring down costs? That's the theory.
Now, polls show that most Americans think that there should be some type of health care reform, but they are deeply divided on what that should look like. What do you think the reaction is going to be if this is struck down?
Well, there's going to be a lot of furor on both sides no matter what happens, especially this is a presidential year. I mean, people are going to take this to the hilt. I mean, you saw some of the protests at the Supreme Court now. I mean, that's going to be nothing compared to what they're going to do if they throw it out or even if they uphold it. So I think things are going to go a little bit crazy, actually, depending on what they decide.
You've done a pretty amazing job of covering this issue over the years. You've talked to patients, you talked to regular people about this. But what has the medical community told you? What are doctors, what are nurses saying about healthcare reform and what President Obama has gotten passed?
Well, I think a lot of the doctors I've talked to think things haven't gone far enough, that they were really hoping for a single-payer system, that everybody would have insurance. It would be like Medicare for everybody. Well, they couldn't do that politically, so that didn't happen. But I think most of the doctors and providers I've talked to, they're very supportive of it because it expands coverage for people. We get government subsidies in a couple of years, free preventive care. I mean, that's all for the good.
Katie, let's start with you. There was a big bombshell this week. San Diego mayoral candidate Nathan Fletcher says he's leaving the Republican Party to become an independent. He says that he's tired of petty politics. But we all know that partisanship has existed for quite a long time. Why is he doing this now?
Well, that's the million-dollar question. He says that he basically reached a tipping point. He couldn't continue on in a party that he felt, as you said, was too partisan, that didn't allow him to form coalitions with members from the other party, basically wanted him to play games. The more cynical view of that would be that, or people would say the more realistic view of that, is that he was trailing in the polls. He wasn't catching up to Councilman Carl DeMaio, who is the front-running Republican at this point, and he needs to do something drastic. The primaries are just over 2 months away, and if he has any hope of making it into one of those top 2 slots, he needed to do something, and this was his big move to, as you said in your intro, divorce himself from the Republican Party and strike out on his own and hope to maybe pick up some of those voters who aren't comfortable with any of the other candidates.
Any sense on how this has helped him so far?
Well, there was one poll that was conducted. Channel 10 used Survey USA to do a poll, and it showed a net gain of about 8% for Fletcher, a bump of 8%. I have to say, though, there are people who have criticized that poll, the wording of the poll. They didn't compare Fletcher to any of the other candidates at that time. They simply asked, are you more likely to support him now? They also, the word support is important. They didn't say, are you more likely to vote for him? Are you more likely to support him? Which some people have said means it's not a really good indicator. It'll be interesting to see in the coming weeks if it really does have an impact, if more polls come out, if his fundraising goes up. Those sorts of indications might tell us whether or not this really will have an impact.
But Katie, he's been attacked by some Republicans in the power structure as being a turncoat and abandoning the party. But what does his move tell Republicans about their lack of tolerance of some of his views?
Well, he will say that he's not really leaving the Republican Party. They have moved too far right for him. And so that is his message, that, he should be able to be a moderate Republican, to be able to, form alliances or, with people across the aisle and still be a Republican and not feel like his party is looking down on him for that. Whether or not the Republican Party agrees with that or whether they take it to heart, I don't know. It's something, and David Brooks mentioned Nathan Fletcher in his New York Times column this morning, talking about how he is a more moderate person and maybe there's not room for him in the party anymore. So it'll be interesting. And David Brooks was asking whether or not Fletcher was essentially a test case. Are there going to be more people doing this? Are people going to vote for him now that he has done this and is bringing more national attention to the race?
Well, parties exist to win. So the question is it going to cause the Republican Party to reflect more deeply? Should it, Kenny?
Well, if I was a Republican in power, I would reflect on it, certainly. But from what I can tell, they'd rather attack than reflect.
Well, you have to say, though, too, the polls did not have Nathan Fletcher as a Republican up there. Carl DeMaio was leading the way.
That's right. The California Republican Party actually endorsed Carl DeMaio 2 weeks ago, and one has to think that his decision to switch parties, Fletcher's decision to switch parties, played into.
Right. Well, Fletcher told me in an interview that he didn't expect to get the endorsement. However, he went to them. He tried to, win it. It didn't happen. I had asked them, well, why didn't you switch before? Before this endorsement came, if that's really something you weren't expecting to get. But he just, says that this has been building for him, and perhaps maybe that was the final straw. I don't know, or maybe it was more calculated.
We're going to have to close it there. Kenny Goldberg, KDR, thank you for speaking.